Two studies showed how light physical activity can improve health. Across the globe, over 5 million people die from causes linked to a lack of physical activity. However, a study published in Journals of Gerontology, Medical Sciences found that standing still was correlated with a lower risk for mortality. In partnership with the Women's Health Initiative, the UC San Diego School of Medicine research team tracked the activity levels of almost 6,000 63 to 97-year-old American women. The women wore a research-grade accelerometer for 7 days. The accelerometer helps the researchers obtain accurate measures of how much the participants spent sitting, standing still, or moving. Women who spent the most time standing were found to have a 37% lower risk of death, unlike the group of participants who did not stand up as often. The highest group was standing still nearly 90 minutes a day, said the researchers. They also noted that a lower risk of death was observed by standing still for 30 minutes a day. However, the benefits of standing were stronger when the women stood and moved around at the same time. In another study, researchers with UC San Diego School of Medicine used physical data gathered from farmers in rural Malawi. Almost all the farmers lacked electricity at home and did not possess motorized vehicles. Meanwhile, Americans lead a technology-dominated lifestyle with phones, computers, TVs, and cars being part of their daily lives. Living this kind of lifestyle increases sedentary time and reduces the need for physical activity. 414 15 to 85-year-old farmers were asked to wear an accelerator each day for 7 days. The team then compared the data to the lifestyles of 3,258 Americans in the same age range. The researchers aimed to determine the potential impact of technology-dominated lifestyles on physical activity and sedentary time. Published in BMJ Open Sport and Exercise Medicine, the Malawian farmers showed significantly higher levels of activity compared to U.S. participants. The Malawian sample met the current physical activity guidelines 94% of the time versus 55% of Americans. The researchers also revealed that Americans spent almost 2 more hours of sedentary time daily, unlike the Malawians. James Salis, PhD, Distinguished Professor Emeritus of Family Medicine and Public Health at UC San Diego School of Medicine, shared his thoughts about the study. He said the research suggests the impact of living a technology-dominated lifestyle, noting that it has become ever more dominant in the world.